The United States is sending $80 million in medical aid to Africa and also committing another $13 million in preparedness efforts to help combat the Ebola outbreak. Health officials in the Democratic Republic of the Congo say that they're in dire need of basic medical supplies. The World Health Organization is reporting 900 suspected cases and more than 200 suspected deaths. There are at least 280 confirmed cases and at least 42 deaths. But the Africa Centers for Disease Control and Prevention say those numbers are likely underreported. Joining me now is Director of the National Institutes of Health, Dr. J. Bhattacharya. Doctor, thank you for your time this morning. A pleasure to have you on the show, sir.
Nice to be here. Thank you.
The numbers that I just listed off seem staggering, with official counts continuing to rise. Will this all continue to get worse before it gets better?
Well, in Africa and the Democratic Republic of Congo, where the outbreak is happening, it's happening in an area where it's under essentially warlord control, and it's difficult for public health folks to come there. We have a CDC team of dozens of people in country helping and coordinating with the DRC, as also with Uganda, where a few other cases have arisen, also originating from the DRC, helping, including providing testing resources. Yeah, it's likely to continue because it's hard to control the outbreak in a region where there's so much instability. But we are, the United States is helping in every way it possibly can, including testing resources, treatment, coordination. The whole CDC team that in the United States and in the DRC has been helping to address the outbreak. It's bad. It's very bad there. But the other thing I want to say, while it's bad there, we've taken every step we possibly can to make sure that the risk doesn't come here to the United States.
Yeah. What is that
for
risk?
The U.S. homeland, there's very minimal risk, and we've worked very hard, including funneling people to airports that are coming from the region, travel restrictions, and we have a dozen or more, you have dozens of places now across the country that are specialized places where people can get Ebola treatment if a case does happen to come in. Very low risk in the U.S., sort of big outbreak in DRC.
Do you have confidence that if, major hospitals across the country, if an Ebola patient walked in, our major hospitals would know how to treat that patient and what the game plan would be moving forward?
Yes. So in 2014, if you remember, the Ebola cases that arrived in the U.S. were treated at hospitals, and a couple of nurses actually got sick from Ebola in treating them. We've learned the lessons from that. We now have 13 different level 1 centers that are specialized in managing Ebola patients. I just went and visited one yesterday in Atlanta at Emory Hospital, and there's also 50 level 2 units. If a Ebola case were to arrive today, the U.S. is absolutely equipped to handle it. It's not likely they'll arrive. It's possible, even with the World Cup, that there may be a case that arrives. We anticipate that's not likely to happen because we've taken every means and precautions to make sure that doesn't happen. But if it does happen, we are absolutely ready to handle this. And all of the medical centers in the country will understand the procedures of what to do if that were to happen to minimize the risk of any onward transmission.
I mentioned that quarantine center off the top that I wanted to ask you about. The United States wants to set up this Ebola quarantine center in Kenya for American citizens exposed to the virus. Locals there are protesting because, of course, they don't want infected patients in their city, and you have recently advised against it. Why would the Trump administration set up the facility against your guidance, sir?
No, so that's not accurate. I didn't advise against it. I'll tell you the reason for the quarantine center in Kenya. And it's not to bring Ebola patients into Kenya. It's in a sort of remote region. It's not risking anybody in Kenya. The reason is because there are some Americans in DRC, medical missionaries and others who are helping with the outbreak. If they get sick, we want a place for those Americans to get treatment and assessed very, very quickly and early on.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.